My name is Barbara Violo, and I'm a pharmacist here at the Junction Chemist. It's a small community pharmacy in Ontario, and a lot of great, exciting things have been happening here in Ontario. As I'm sure you're all aware, we've adopted minor ailment prescribing. Minor ailments is something that we're so familiar with, and it's actually kind of empowering for us to be able to help patients, because it's similar to what we do every day anyway in normal practice, except now it's just, instead of trying to help the patient find a walk-in clinic or a hospital that they have to go to, especially on weekends or late at night, it's almost like you're able to finally provide that care. And it just creates this amazing relationship with your patients because they trust you and they're so grateful. And then word of mouth, they start telling all their friends, this is the pharmacist that helped me. And then, it actually drives business in a way as well. Most of the encounters with patients just start off as a regular OTC consult. It's generally something like, if somebody has a cold sore, they'll come in and be like, I have a really bad cold sore, do you have something over the counter? Because right now it's not that well known, and it kind of generates that conversation. And you can ask them if they would like to have a consultation. And at that point, you'll go through all the questions, make sure the red flags aren't present. Cold sore red flags would be simple things like a fever present, the lesions being in the wrong place, a different area, a cold sore that's resistant to treatment, that would need referral to a physician. So every consultation and assessment doesn't always end in prescription. You can also recommend over-the-counter therapy if you still think that that's more appropriate, or you can refer to a physician if you feel not comfortable or it's out of your scope. When you do start prescribing for minor ailments, you don't have to jump on top of all of them. You can start with what you're comfortable with. If you're comfortable with cold sores and maybe eczema or allergic rhinitis, you can start with the ones that you're comfortable with, and then maybe do some reading and some coursework about the ones that maybe you're not so familiar with, and then eventually start prescribing for those as well. So it takes all of that unable to get help, that fear the patient has, the searching, the long wait times. It takes that all out, and they're able to come to where they're comfortable, their community pharmacy, with the person that they're comfortable with, their pharmacist. We know their medication history, we know their background, we know their families, like we have a really good relationship with them. So they get to come to a trusting place and they get seen right away. And they're very, very grateful for the service. And it also it helps all of us too, because it unclogs the healthcare system with all unnecessary minor ailment appointments. And now it's like everything else, once you get comfortable with it, it's like second nature.